Good afternoon, everybody, and you're very welcome to today's HSE webinar on the Childhood Obesity Surveillance Initiative. You're all very welcome. Today we're in Zoom webinar format, and as I give you a chance to come in, we might just do a little bit of housekeeping. As you'll notice at the bottom of your screen, there's a Q&A button, and we would welcome you to use this Q&A button to ask questions right throughout the event, and we will leave time at the end for some live Q&A where we'll address the most frequently asked questions. So without further ado, I'm going to hand you over to your host for today, Sarah O'Brien.
Good afternoon, everyone, and welcome. Thank you for joining us this afternoon to hear the results of the latest round of the World Health Organization Europe Childhood Obesity Surveillance Initiative here in Ireland. As Leah mentioned, I'm Sarah O'Brien. I'm the National Lead with the Healthy Eating Active Living programme in the HSE, and I'm hosting the session this afternoon. I'm really delighted to have with us Professor Cecily Kelleher and Dr. Lachlan Mitchell this afternoon to share from UCD to share the findings. And joining us also will be Dr. Stephanie O'Keefe, National Director, Strategy Planning and Transformation here in the HSE, and Minister Frank Feehan, Minister of State for Public Health and Wellbeing and the National Drugs Strategy. So as we start the session this afternoon, I think it's really important that we recognise that when we are speaking about childhood weight, overweight or obesity, it's not a child's shape or size fitting with a socially constructed norm that is our focus. Body weight in general is not a choice. It is the result of a complex interplay of genetics, the environment that our children are born into, and the opportunities available to them and their families. Most of our children here in Ireland are a healthy weight, however, some aren't. And healthy weight for our children is important because we know that the consequences of childhood overweight and obesity can have lifelong effects, affecting both a child's quality of life and their health. The research shows that the adverse consequences can affect the physical, behavioural, psychosocial and the economic welfare of children and their families, both in the immediate and longer term. The World Health Organization recognizes obesity in and of itself as a progressive, chronic and complex disease. At a clinical level, obesity in children, which is where a child has a BMI of greater than or equal to 98, the 98th centile, is causally associated with a range of complications in childhood and adolescence, including asthma, musculoskeletal pain, type 2 diabetes, depression and anxiety. And we know also that overweight and obesity in early to middle childhood can track through into adolescence and from there into adulthood. A successful childhood obesity prevention approach requires a broad and inclusive focus, taking into account all of the factors that contribute to the obesogenic environment. The public health challenge of overweight and obesity has arisen over time, influenced by changes in our environment, such as the availability, affordability, and marketing of food, the type and volume of foods consumed, coupled with a decline in active lifestyles and an increase in sedentary behaviours. The food industry and our social norms play an important role here also. By working to create healthy environments and behaviours at society and community level that are supportive of health and well-being, as well as intervening early to support children and families who need help, we know we can support healthy growth and development for all. Population surveillance efforts like the Childhood Obesity Surveillance Initiative are an important part of that picture. They're critical as a means of assessing our progress and the impact of our interventions over time, because as the public health challenge of obesity has developed over time, the impact of our interventions will only be seen over a longer time period. So now I would like to introduce Dr. Stephanie O'Keefe to say a few words. While working with many of you will know Stephanie, but while working with the Department of Health, Stephanie led the development of the Healthy Ireland Framework, our national whole of government strategy to improve health and well-being and reduce chronic disease. On moving back to the HSE, As part of a much wider brief, Stephanie has overseen the development of the Healthy Ireland and the Health Services Implementation Plan and the establishment of a number of policy priority programmes to provide leadership and direction for the implementation of key national policies and strategies across the health services, one of which is the Healthy Weight for Ireland Obesity Policy and Action Plan. So welcome, Stephanie.
So thank you, Sarah, and good afternoon, everybody. The increasing levels of overweight and obesity in children is an important public health issue, not just in Ireland, but worldwide. In 2008, the World Health Organization initiated the Childhood Obesity Surveillance Initiative to provide ongoing, systematic processes for monitoring childhood obesity in the European region. And Ireland is just one of 13 countries who've participated in the initiative. And as we all know, from our very many expert clinicians and healthcare professionals, obesity is strongly associated with risk factors for cardiovascular disease, diabetes, and orthopedic problems. And in recent years, conditions that were previously only seen in older populations have emerged in the population of children who have overweight or obesity, including prediabetes, type 2 diabetes, hypertension, sleep apnea, and also some cancers. This consequently increases the risk of early death. It's estimated that over 85,000 children on the island of Ireland will die prematurely because of childhood overweight and obesity. There is strong evidence that living with overweight and obesity also affects children's psychological well-being and interpersonal relationships. And this is preventable, and it's a priority for us. We've been working with the UCD School of Public Health and Population since 2008 to measure weight, height, BMI for children 7, 9 and 11 years of age. This also included calculating the prevalence of underweight, normal weight, overweight and obesity. Of the 5 rounds of data collection, a total of 22,846 examinations have been analysed. And on the back of our whole of government, whole of society, Healthy Ireland framework, in 2016, the government published a Healthy Weight for Ireland Obesity Policy and Action Plan, and this identified 2 particular priorities for the HSE. One of these was to mobilise the health service with a focus on prevention, and the other was to develop a service model for specialist care for children and adults. We have a number of policy priority programmes in the whole area of prevention, ranging from alcohol to tobacco to sexual health. And one of those really important ones is the Healthy Eating Active Living programme. And this coordinates and drives a series of evidence-based actions to deliver on this Healthy Weight for Ireland action plan and indeed the physical activity plan. It's carried out with a whole range of internal and external partners to promote healthy weight and to prevent childhood obesity. So, for example, in partnership with the Royal College of Physicians in Ireland, the National Clinical Management Programme we've established in 2017 for obesity, this has developed now a model of care for the management of overweight and obesity. Following consultation with a range of stakeholders, the model of care is currently being finalised. In partnership with Safe Food, delivery of the START programme to empower and support parents to make family-based lifestyle changes to prevent childhood obesity, delivering training to healthcare professionals on healthy childhood growth and development, including breastfeeding, healthy eating, physical activity and sleep, delivery of training for health professionals on how to make every contact count by engaging parents in a brief intervention conversation in relation to their own diets and physical activity levels, as well as that of their children. Growth monitoring as part of routine child development checks by public health nurses, and the health and wellbeing checks offered to all children aged 2 and 5 years of age as part of the GP under 6 contract. The provision of training and resources to support schools, primary and post-primary, to implement a whole school approach to healthy eating and physical activity in partnership with the Department of Education, Training and Skills through the Wellbeing in Schools framework. Provision of training resources to support early years and preschool services implement a whole service health promotion approach through the Smart Start programme. The provision of training and resources to support the development of community health promotion programmes such as the community cooking programmes and physical activity participation programmes run through local sports partnerships. I'm really pleased to see a strengthening of the pattern that sees a reduction in overweight and obesity for children in early primary school years, but I'm emboldened to do more, to bring more evidence to bear on the health disparities that sees higher levels of obesity and overweight among children attending designated disadvantaged schools. We need to do more and we need to do better. to create healthier environments and to enable healthier behaviours for children who may be struggling in other ways due to social and economic disadvantage. Over the last number of years, we've been experiencing significant demand and capacity issues in the provision of healthcare. One of the reasons for the Healthy Ireland framework to improve population health, reduce health inequalities, so as to build a sustainable healthcare service and to contribute to vibrant local communities now and into the future. The children of today are the adults of tomorrow. COVID-19 has put this challenge for the health services into stark relief. And it is essential, especially now as we're grappling with and living with COVID-19, that we strengthen the prevention agenda to gain more ground and more traction. And this type of robust population surveillance efforts, like this done by the UCD School of Public Health and Population Science, is essential in allowing us to track and to assess what's working well, and where do we need to do better. I would really like to thank Minister Fainan for launching this report today, and I'd particularly like to thank Professor Cecily Kelleher, Dr. Lachlan Mitchell, UCD School of Public Health and Population Science, for carrying out the research with their colleagues, and all of the parents and children who participated, and indeed the myriad of health and social care staff and experts working at national and community level across a whole range of sectors, working to create healthier environments and enable healthier behaviours. Thank you very much.
Thank you. Thank you, Stephanie, for those kind words. So now I would like to invite Professor Cecily Kelleher and Dr. Lachlan Mitchell to present the findings from the research. Professor Kelleher will be well known to many of you in the audience, I'm sure. She is Principal of the College of Health and Agricultural Sciences at UCD and Professor of Public Health Medicine and Epidemiology. Her main research areas are understanding how cardiovascular disease and obesity patterns vary over time and between countries, and how these are affected by the life course and genetic influences. She has led the COSI research team since its inception. And Dr. Lachlan Mitchell, the current manager of the National Nutrition Surveillance Centre at UCD, lead author on the report we're launching today, a dietitian and exercise scientist. His research interests focus on nutrition and exercise across the range of topics, including childhood obesity, sports performance, and nutrition knowledge. So over to you now, Cecily and Lachlan.
Sarah, thank you very much indeed. And colleagues, Minister Fionn, all of those who are participating this afternoon, it's a great privilege to be here to present to you the Childhood Obesity Surveillance Initiative, Round 5, the results for 2018-19. And Dr. Lachlan Mitchell and myself will go through these now on behalf of the National Nutrition Surveillance Centre. So as we see in the first slide here, the global prevalence of childhood obesity is a major challenge to us all. We have, of course, a problem with adult obesity as well, but childhood obesity is particularly important because of the fact that it tracks potentially over the life course. And as Sarah indicated earlier, it presents a very important challenge in terms of morbidity and mortality over that life course. We see here the world obesity data from the Federation in London in 2019. And you can see for the prevalence of overweight, including obesity, for both girls and boys, ranging from less than 5% to 25% plus, that this poses a major challenge across the Americas, in Australia, in parts of the Middle East and Europe. And of course, there's also the ongoing issue in relation to undernutrition. And there are some particular areas in the African region that have been particularly recently affected. So this poses us a major challenge to be addressed. And if we move to the next slide, we have seen a number of very large-scale studies in recent years that have benefited from pooling data from studies over time. And these have allowed us to look at this over the last 35 years or so. And here you see this first one from the Global Burden of Disease Studies, which looked at the prevalence of overweight and obesity in children over a 33-year period, representing a very large database of over 1,700 studies in 188 countries. These data look at children from the ages of 2 to 19. And we use here in this particular study both self-reported and measured height and weight using the International Obesity Task Force cutoffs. So the first thing I think to note is looking between the developed and the developing countries for both girls and boys between 1980 and 2013. Rates were 16.2% in developed countries and half that in developing countries in 1980, and have now climbed in this analysis to 22.6% in girls and 13.4% in boys in the developing countries. And similar effects are seen in boys. This also shows us observed distinct geographical patterns, particularly high rates emerging in the Middle East and North Africa, in the Pacific Islands and in Caribbean nations, as we've seen in the earlier slide. If we move to the next slide. Here we have a data again from the very large scale global burden of disease studies. And these again have had the opportunity of pooling international data sets. Here again, 1,400 plus studies in 173 countries. These data look at children from the ages of 2 to 19 years, and again look at self-reported and measured height of weight with IOTF cutoffs. And we see here from 1980 right through to 2015 that this middle yellow line here of the global trends have been upwards, and also that the quintiles, according to the socio-demographic index of development, show very considerable variation. And these were narrower in the 80s and now show a broader range in 2015, but increasingly we're seeing that this is moving from the developed to the developing countries. A notable point is that the rate of increase in child obesity in that period had been greater than the rate of increase in adult obesity. And continuing to the next slide. The NCD risk study published in The Lancet was indeed the largest yet, and that was produced in 2017, and it looked at worldwide trends in body mass index, underweight, overweight, and obesity from 1975 to 2016. And this is an important study because it has incorporated a number of the Irish data sets that we've been collecting in this country, including the SLAN and some of the earlier COSI surveys. And again, it looked at trends of BMI by global region from 1975 to 2016 in 2,500 pool studies with 31.5 million children and adolescents from the ages of 5 to 19 included in that. This paper is worth looking at in detail because it looks across the globe at these trends. And it does show, which is interesting and important to what we look at later, that children and adolescent patterns have plateaued in many of the higher income countries, albeit at high levels, but are accelerating now in Asia, with trends no longer correlated with those of adults, which is important in thinking about the causal patterns. And we see here, for instance, where blue goes from underweight through green to healthy weight, through orange and for overweight and obesity, that these were continue to be appreciable trends, but in recent times have been plateauing. And that is a significant issue for further investigation. Moving on then to the COSI study, as Sarah said and Stephanie said in the introduction, Ireland was to the forefront in joining this consortium, which has been led from the European Office of the World Health Organization. And this childhood obesity surveillance initiative has been going from strength to strength since it was established. In round one here in the lighter color, Ireland was one of the early participants, and we see through rounds 2, 3, and 4 over the ensuing decade, more and more countries have been joining in this. So why is this important if we're focusing on a region as we are in Western Europe? It is very key that we would have standardized and systematic data so that we can compare within and between countries, and that these protocols are developed on that basis. So we have the basic examination data that is being collected through standardized protocols, and also additional survey information on the school environment and on the families that are participating in these studies. They afford us an opportunity to look in more depth at the variations within and between countries. And they also, provided countries can follow the stipulated requirements for the protocol. In our case, we have data for children exactly age 7 as part of the international part of the consortium. It is possible for countries to collect additional data, as we have been doing here in Ireland. I stress these are for surveillance purpose. This is not a screening exercise, but it's also very important because the school is a key health promoting setting, and these data are collected in that environment. If we move to the next slide. In these rounds, we have been reporting at the level of the international data, but also the national data. A very large volume of peer-reviewed papers are now coming out, which are looking in more detail at what we can learn from this. But I'll highlight here the patterns of overweight and obesity from the round 4, 2015-17, to show you that we can compare data from girls and boys in the blue and girls in purple here, but also that it is quite variable in terms of this using a systematic protocol. And so it's an important key to understanding why these patterns vary in relation to socio-cultural and other influences, but also boy-girl patterns aren't always systematic. In some places, the rates are higher in boys and sometimes in girls, and vice versa. And this is an ongoing issue to understand. And if we move to the next one, where are we at the moment? Well, as of June this summer, what countries or entities have completed the COSI round 5 data collection? Here again, we see the map, and we know that 34 countries had completed the wave in 17-19 collections. This includes the large urban conurbations in Bremen in Germany and Moscow in Russia. And these countries have now collected the data, and we are in the course of cleaning those data, analyzing them. And today we will be giving you our round 5 COSI data. 6 countries, unfortunately, including the city of Ekaterinburg in Russia, were not able to complete data collection because of the COVID pandemic. And 4 countries will not be collecting data in this round, with 2 countries with no available data as of the summer. And of course, this is an important issue because the COVID-19 pandemic has posed a major question in and of itself as to what influences that might have long-term on rates of overweight and obesity in the population for children and adolescents and across the life course. And more research will be certainly required. But for the purposes of our presentation today, our data were undertaken and collected in the autumn-winter of 18-19 before the onset of the pandemic. I'd now like to hand over to my colleague, Lachlan Mitchell, who will take you through, and we have reports 1 published in 2008, 2 and 3 in 2012, round 4 in 2015, and Lachlan will talk you through the findings from round 5 from this point. Thank you.
Thank you, Cecily, and thank you, Sarah, for that introduction. I'd like to shift the scope of our focus onto now the present round of data collection for the Childhood Obesity Surveillance Initiative, starting briefly by giving a bit of a background on the methodology used in the present round. 185 schools were invited to participate in round 5 of COSI. These schools were selected based on their previous participation in round 1, which took place in 2008. These schools varied in size and location. We were able to distinguish between urban and rural schools. And schools classified as disadvantaged under the DESH classification system were also included. Based on the rigorous selection protocol used in round 1, this sample of schools was representative of all Irish schools. The primary objective of COSI was to assess the weight status of children in 1st, 2nd, 4th and 6th class. For this to take place, researchers went into schools and collected basic anthropometric assessments on children in these classes. In addition, the participating schools were asked to complete a school survey, which examined physical activity and nutrition and physical activity environments inside the schools. Families of participating first and second class children were also invited to complete a family survey, which collected data looking at nutrition and physical activity outside of the school environment in the family setting. Considering the participation rates, as I said, 185 schools were invited to participate in round 5. Of these schools, 135 agreed to take part. This represented about just under 75% of the invited schools and is a similar participation rate to previous rounds of COSI. Included in those 135 schools were 21 DESH schools out of a possible 26 which were invited to take part. Overall, over 5,500 children were examined in COSI in round 5. This represents about 60% of all eligible children that were in invited schools. Participation rates were similar between boys and girls in round 5. However, there was a difference in participation rate between children attending disadvantaged schools and non-disadvantaged schools, with children attending the best schools participating at a rate of just over 45%, whereas the non-best schools were approaching 60%. Moving on to the results specifically, overall we found that approximately 1 in 5 children were classified as having overweight or obesity using the IOTF cutoffs. These rates tended to increase with increasing age. You can see the figure on the left there. You can see that in grades 4 and 6, the prevalence rates increased above 20%, whereas the lower grades, so first and second class, the prevalence rates were below 20%. We also identified differences in prevalence rate between boys and girls. This was primarily driven by children in first and second class. Again, looking at the columns on the left side of the figure, you can see that the prevalence rates in girls is up towards 20%, whereas in boys it's down below 15%. And this is driving that significant difference between boys and girls in overall prevalence. We found that also overall approximately 60% of children were classified as underweight. Primarily, most of these children were classified as category 1 underweight. Based on our assessment techniques, we were able to also compare the prevalence rates between schools classified as urban and classified as rural. We found that there was no significant difference in prevalence of overweight or obesity based on attending an urban or a rural school. And this followed the same trends identified in previous rounds of COSI. Similarly, we were able to distinguish between the disadvantaged and non-disadvantaged schools. One of the primary outcomes that we identified in round 5 was a significant difference in prevalence of children who have overweight or obesity based on attending a disadvantaged or a non-disadvantaged school. What's particularly important is that trend of an increased difference between the two categories with increasing age. Looking at the figure here on the slide, we can see that in grade 6 in particular, the disadvantaged schools, so children attending those DESH schools, the prevalence rates was approaching 40%, whereas the non-disadvantaged schools' prevalence rates was below 20%. So as I said, this is one of the primary outcomes to come from the round 5 data collection for COSI, and is certainly a trend that was identified previously, and it reflects worldwide trends based on socioeconomic disadvantage. If we start to examine the round 5 data in comparison to previous rounds of data collected here in Ireland in the Childhood Obesity Surveillance Initiative, we can see that the trend for a plateau in overweight and obesity prevalence, which was identified in round 4, appears to be continuing in the present round. The figure on the left there represents overweight and obesity prevalence in first class children throughout rounds 1 through 5. And you can see there that there's a distinct levelling off of prevalence moving from round 3 through to rounds 4 and the present round 5 data. Likewise, the figure on the right, which presents prevalence data for children above first class from rounds 2 through to 5. Again, you can see that there is a distinct levelling off in prevalence when you look at those the bars on the right side of the figure, moving through rounds 3 through to round 5. The question to come from that would be, therefore, how does this data compare to worldwide trends? Well, there is some evidence to suggest that there is a plateau in obesity prevalence amongst children in developed countries, rather. A couple of examples here. The first figure on the left there comes from the Australian Institute of Health and Welfare. Their most recent data collection survey shows that there is what appears to be a trend in a plateau of prevalence amongst children. Likewise, evidence from the Health Survey for England between 1995 and 2018 suggests again that there is a plateau in prevalence in children in most recent years. As such, the evidence that we've identified here in round 5 of COSI, in that there being a trend in prevalence, appears to be reflecting worldwide prevalence rates amongst developed countries. Shifting the focus more towards the school survey now, which again, as a reminder, collected data regarding the nutrition and physical activity environments in schools. We can see that the school environment for nutrition, we identified several positive outcomes. Firstly, most schools are free from advertisement of energy-dense and nutrient-poor foods, and most schools include nutrition education in their curriculum. Furthermore, all schools are free from vending machines, which fits in with the school environment guidelines here in Ireland. 93% of schools are free from sugar-sweetened beverages, and 92% of schools are free from sweet or savoury snacks. And about a quarter of schools provide fresh fruit for their children on site. Looking also at the physical activity environment in schools, again, there were several positive outcomes to be identified. All schools have outdoor play areas available for children to access, and all schools include physical activity in their curriculum. The median physical activity duration is 60 minutes per week in schools. 3/4 of schools, in addition to having an outdoor play area, also had an indoor gym available for children. Other data to come out of the school survey regarding physical activity environments showed that more than 60% of schools organise sport or physical activities for children outside of school hours. Unfortunately, though, 2/3 of these schools reported that less than half of children actually attend these activities. Finally, we also asked schools to indicate perceived barriers to meeting physical activity recommendations in the school. 45% of schools indicated that facilities were a perceived barrier to meeting these recommendations, and 37% of schools perceived time to be a barrier to meeting these recommendations. So in conclusion, as I said, the prevalence of overweight, including obesity in Irish school children, appears to be stabilising in around that 1 in 5 children rate. There were differences apparent between boys and girls, and this was more so apparent in the younger years. Having said that though, the prevalence rates tended to increase with increasing age, and as Sarah and Cecily have both indicated, we know that childhood obesity does track into adulthood obesity, so it's of concern that as we move through the ages in primary school students, we see an increase in prevalence of overweight and obesity. Also of concern was the distinct difference in prevalence that was identified between disadvantaged and non-disadvantaged schools. Again, this difference was increasing with increasing age. Moving forward from here, it's essential that we can identify and respond to mechanisms responsible for these differences between boys and girls, and the difficulties that socioeconomically disadvantaged individuals and families are facing. To finish off, I'd just like to formally acknowledge the assistance that we received from the Health Service Executive, the Department of Health, and the Department of Education and Skills in conducting this study. I would also like to thank the World Health Organization Regional Office for Europe. As Cecily has indicated, the Irish branch of the Childhood Obesity Surveillance Initiative is a part of the wider European Childhood Obesity Surveillance Initiative. Of course, I'd have to acknowledge the participation of schools, teachers, parents and children. Without them, we couldn't be conducting this kind of surveillance research. I'd also like to formally acknowledge the wider National Nutrition Surveillance Centre research team here at UCD, Dr. Sylvia Bell-Surratt, Dr. Miriam Heinen, Dr. Celine Murren, Isabel Stanley, Dr. John Megan, Tara Hegarty and Lara McCann. Thank you for your attention, and I look forward to the panel Q&A later on.
Thank you, Lachlan and Cecily, for a really interesting and illuminating presentation there. The result of a lot of hard work by the team out in the National Nutrition Surveillance Centre. And it's great to see that despite COVID and despite lots of different challenges that Ireland continued to be continue to be able to participate in COSI this year and have this fantastic fifth round of data available to us. I can see here some very interesting questions coming in from our audience. So just to remind you all that if you have any questions or that you do use the Q&A button at the bottom, and we'll have a live session at the end. We'd be delighted to hear from you during that session as well. So if you want to, when we get to that session, you can put your hand up and speak to our panelists and have a live discussion there. It's very different being at one of these events through a webinar compared to what we used to in our live audiences. It's hard to know that we're keeping people awake out there. I'm sure we are from the looks of the questions coming in. Before we go to that live session, though, I am going to welcome Minister Frank Feehan, the Minister of State for Public Health and Wellbeing and the National Drug Strategy, to speak to the findings of the report.
Good afternoon, everyone. I'm delighted, even in these unusual circumstances, to launch the latest round of the Childhood Obesity Surveillance Initiative. Firstly, I want to thank the research at UCD, HSE Health and Wellbeing, and especially all the young people who participated in this research. Your hard work and valuable input is very much appreciated. I welcome the publication of this important report, which is a significant indicator of the progress we are making in relation to the obesity policy and action plan. Childhood obesity is, of course, a particular focus of the plan, and it is a priority of this government and of mine as Minister for Wellbeing, and as a father of 2 young children myself, it is an area in which I take a keen personal interest. Since the previous COSI report, there have been a number of developments under the Obesity Policy and Action Plan, which was launched in 2016 under the Healthy Ireland framework. I'd like to briefly outline some of these achievements. Less than 2 weeks ago, I helped to launch the Healthy Eating Guidelines for the food pyramid for 1 to 4-year-olds. I think this is a hugely important development. It provides an easy to follow set of resources to help those looking after our youngest children to provide them with nutritious and balanced food and appropriate portion sizes. And as we know, healthy habits, when formed in the earliest years, will have a better chance of being continued into primary school years and indeed throughout life. These complement the guidelines and food pyramid for adults and children over 5, which were published and distributed to schools in 2017, with nutrition standards for schools also developed. Those standards apply to the school meals programme, which benefits more than 250,000 children across Ireland and gives priority to children in DEIS schools. The HSE established a Healthy Eating Active Living programme as a policy priority programme and appointed a first national clinical lead for obesity. A model of care for the management of overweight and obesity in children and adults is being finalised. In 2018, as you all know, the sugar sweetened drink tax was introduced, which aims both to reduce consumption of sugar sweetened drinks and to encourage manufacturers to reformulate their products. Early indications are that it is having some success in this. Physical activity is of course very important in preventing and combating childhood obesity, and in this area there has been good progress since the publication of the National Physical Activity Plan in 2016, with successful programs in schools such as Active School Flag and the Daily Mile. These of course are long-term measures, and it must be emphasised that childhood obesity is a serious challenge and a complex problem, and combating it needs every sector of society to play its part. So against this background, I am pleased to see that there are some signs of progress in the findings of this report. However, while these are all hopeful signs, there is certainly no room for complacency, and I'm not going to claim that everything in the garden is rosy. The overall levels of childhood overweight and obesity are still far too high, and more progress is needed. The levels for girls are also higher than for boys. And it is worrying that the levels for children in DESH schools are not showing the stabilisation that it is recurring elsewhere. Clearly, there is a lot more work to be done before we can say we are winning the battle. But as I have said, this is a priority area for me and for this government, and it's one on which we will continue to maintain focus. With the work underway and the efforts of all our stakeholders, I am optimistic that by the time the next round of COSI is published, we will see further progress in this crucial area. Thank you.
Thank you, Minister Fian, and it's great to hear that strong commitment from the Minister to continuing the really good work that's been started in this area to address, or not started, but being continued over the last number of years in this area to address the whole area of improving how we prevent childhood overweight and obesity. So I'm going to start the live panel session, live panel Q&A session by inviting the panelists to join the virtual stage here. So that's Professor Cecily Kelleher, Dr. Lachlan Mitchell, and Dr. Sylvia Belsarat from NNSC, from the National Nutrition Surveillance Centre. Hey, welcome guys. I'm just going to kick off with some of the questions that have come in. I know we can, I don't think I can see if people raise hands, Leo, but if people do want to ask a question live, you might let us know. We'll go with the few questions that have come in while the presentations were going on. Cecily, or Lachlan, actually, I might put this one to you if you don't mind. Somebody has asked, just in view of the results presented today, do you have a clear picture in terms of whether the situation around overweight and obesity prevalence in children has improved or gotten worse in comparison with previous rounds? I know we had some data presented there comparing us internationally as well.
Overall, all children?
Yeah, in all children.
Yes, so in all children, yeah. So in the previous round, in round 4, the NNSC identified that there is what appeared to be a plateau in the prevalence rate. So the rates were no longer increasing. Following on in this round, the data would suggest that again that plateau is continuing on. So it's by no means getting worse, and I guess in one way that is positive, but we're not seeing the decline quite yet that we'd be aiming to achieve ongoing from here. I can see that Ellen, one of a subsequent question is regarding the disadvantaged schools. Unfortunately, it looks like that plateau in prevalence in all children isn't being reflected in the disadvantaged schools, in that that difference is increasing between disadvantaged and non-disadvantaged schools. So I think those DESH schools in particular are a unique population that needs to be addressed separate to the broader population, because, as I said, the prevalence rates appear to be increasing in those children.
Okay, thank you, Lachlan. I think it is one of the stark findings in the research is the gap between the DAISH schools and children attending DAISH schools and children attending other schools. It's quite it's quite substantial, isn't it, really?
Yeah, and I would say Ireland isn't unique in that situation, in that in a lot of countries globally, we do see a very distinct difference in overweight and obesity prevalence based on socioeconomic disadvantage. So Ireland is by no means unique in that, but that still doesn't mean it's not something that Ireland can address uniquely, I think.
And if I might follow on.
Thank you, Lachlan.
Sarah, if I might follow on from that.
Yeah.
We're giving a very careful attention to this gradient. As you know, fairly consistently since we began the COSI surveys, we have always seen this disparity between the DESH and the general schools. And I think it's very important. Some of these figures look on the face of it to be quite stark, but numbers are small and we must be conservative about that, because by definition there are less disadvantaged schools in our sample, and there are fewer people who are actually overweight or obese when you get into that subsample. So certainly we have to look carefully at the numbers, but from the point of view of consistency of the disparity and the fact that that gradient seems to be widening, we really do need to give it some attention. And I think, as Lachlan has indicated, this pattern is being seen globally. The most recent figures from the National Child Measurement Programme in our neighbours in the UK show very similar worrisome trends. And I think we now have to really focus on how our main messages are getting across and how we can reach and support younger people in school environments and generally from disadvantaged backgrounds in order to stem this.
Okay. And I suppose picking up on that that theme around health inequalities and the differences in trends between the DAISH schools and children attending other schools, we have a question in here in relation to what is being done in terms of policy for this. Is the school meals programme being effective in view of these findings, in your opinion? So Cecily, I might pop that one to you if that's okay. If we don't have Sylvia, I know Sylvia would have done some work around the school meals.
Sylvia may well be here, and if she is, she's happy to chip in.
Sylvia's there, all right?
Yeah.
Okay,
Yeah,
Sylvia.
So what we are doing at the moment, so in order to maybe try to look at this gap and try to act in this regard, we are currently working on a couple of projects on that. So we are not specifically looking at or trying to prevent overweight and obesity, because this is more like the last outcome, but we are targeting behaviors at the moment. So for these couple of projects, we are working on one that is to develop an intervention study on how to promote vegetable intake among low-income adolescents, because what we have seen that there is not only a gap in terms of overweight and obesity prevalence, but also in terms of behaviors. So those from more deprived areas have been shown to eat less fruits and vegetables than others from higher income areas. And then also another piece of work that we are working on at the moment too, it's the health literacy project, so among low-income adolescents as well. So in that sense, what we are trying to do is to provide them with the skills they need
and so that they are aware of their dietary habits and their physical activity behaviors, so that they are aware of that, of them, and they can improve them.
And I'd also say, sorry, Sarah, that it's very clear that we have to take a life course approach to this, and I am aware that the HSE has been looking at improving well-being of young children through the My Child website and My Child programs. The whole question around CPD training for health professionals and addressing growing monitoring and physical activity and sleep. The START campaign. Breastfeeding is a long-standing issue that I think is extraordinarily important too. And then the whole question of working with programs around parenting skills, Smart Start. I know that with Professor Donal O'Shea, we've been looking at schools-based programs. So all of these are approaching this from a life course perspective. I'd say this needs to start at the very earliest stage. I've been a promoter of transition year programs for those who are intending parents as much as anything else for a long time. And I do think we need to be concerted, take that long view, look at it from a multi-sectoral point of view. But also we need to recognize the key question around inequalities is we have to ensure that there is an affordable food supply and that people have the disposable income relatively to buy the kind of healthy food and options. So we do have those policy questions to keep to the forefront, especially in urban environments. That said, if it doesn't make it too complicated in the Western world now, we're increasingly seeing that overweight and obesity is growing in rural waves as well as in urban waves. So at all times, I think we have to be alert to the obesogenic environment and really look in a detailed way at how programs might be developed that would be supported.
Okay. Thanks, Cecily and Sylvia. Cecily, I know you mentioned Professor Donal O'Shea there, and I know we have Donal in the audience. So Donal's working, as you know, will be working with us in the HSE as a clinical lead for obesity management, as well as having been a long-term advocate around action to address the obesogenic environment. So Donal, if you don't mind, I might call on you from the audience to respond to this this question. There's a strong association between overweight and obesity in childhood and chronic disease in adulthood, and we know that, as been said earlier today, that overweight and obesity in early to mid-childhood can track through into teenage years and into adulthood. And we also know that many of us have overweight and obesity as middle-aged and older adults than did as teenagers or young adults. So there's a complexity there between. It's not a clear linear process, I suppose. So while it's very positive that overall 4 out of 5 primary school children have a healthy weight, it is of concern the disparity between those who are living in more disadvantaged areas or attending schools in more disadvantaged areas, and particularly for the difference between boys and girls. So I suppose in summary, the question is, are we on the right track, or what more do we need to do to maintain the positive trends and address the worrying ones? If that's not too big a question to be addressing on a Wednesday afternoon, Donal.
And it's a big question, and it's been it's been really fascinating as a session, and I think we are all getting used to webinars, but the number of delegates attending is definitely bigger than if we were in a room in a city in Dublin. So there is that advantage of spreading the word, and I think that's really important. It's absolutely a real issue. I mean, I drive past a DEIS school on the way to work every day, and last week I saw 2 young boys who are clearly living with significant overweight, getting off the bus and lighting up cigarettes on their stroll to school. And I'm just looking at this cardiovascular time bomb that is very real and walking into a DEIS school. So I accept what Cecily says, that the numbers are relatively small, but it's global, or when you look at it in terms of the trend in that socioeconomic divide, and it's real. So I think we have to continue to redouble our efforts. Stephanie did mention the model of care for obesity that is being developed with input strongly from the patient, like individuals living with obesity. And that will be a model of care for children and young people that will be aligned with the pediatric clinical program. And then in adults, the model of care will align
It was frozen.
Oh,
Yeah, we lost Donald, I'm afraid.
We lost Donald. Oh my. That's a
I think he has made an excellent point. Point.
Absolutely, and I suppose it is that piece while Donald was linking very much or highlighting what we know from the Healthy Ireland survey in adults, that there tends to be a clustering of behaviors and things like overweight and obesity that have a multiplier effect in terms of chronic disease and premature death for people. I suppose it is the fact that probably people that as Stephanie has mentioned, it's not just the lifestyle factors that people and children in these communities are struggling with. There's other social and economic factors that predispose to disadvantage as well. So things like employment, education, all of those pieces that we really need to look at in a concerted way across society. So I suppose that is one of the positives of the Healthy Weight for Ireland Obesity Policy and Action Plan, in that it does require and is driving multi-sectoral action, and is putting child health and well-being in its broadest sense on the table with multiple government departments. So as Minister Fian was saying there earlier, hopefully the next time we're here discussing the next round of COSI results, that we'll be seeing some of the impact of that action. Taking us back specifically maybe to the COSI data set, Cecily, and as Donald mentioned there, the model of care. I know from looking at the model of care that it does highlight that for minority ethnic groups, they are at I suppose greater risk of developing the complications of overweight and obesity at lower cutoff levels than the general Caucasian population. And I'm just wondering, in terms of the data set, the COSI data set, given that we have a more diverse population in Ireland now, and that is reflected in our school settings, whether it is possible to look at that through the COSI data set.
So a very important point indeed, Sarah. I think the COSI data set it collects demographic information, but it doesn't, at the point of examination of the children, record ethnicity. So we don't have that data. We do have some information in the family survey, and we certainly could pool the repeated sweeps there to see is there something important emerging in that. It's certainly a consideration that the international database can look at. And I think that would be important. Again, looking at the very recent data coming from the National Child Measurement Programme in the UK, where they do look at these trends. There has been some downward trends in some groups, for instance, Bangladeshi girls with higher rates in English girls. So it's an international issue and it needs to be addressed. I'd also like to stress that I think it's very important that we look at all our citizens in relation to this. I've long been an advocate for the health promotion of the traveller community, and I think that further work on that would be very welcome, since the work that we did in 2010, though we can't really address that in a data set like COSI or indeed in the national surveys. And of course, it's a well-established issue for us in looking at low birth weight and its long-term risk for a healthy phenotype, looking at that in international data. So we'll take a look at what we do have and ensure that it's fed into the international conversation.
Okay, that's great. It's great to see that. I suppose that is one of the real strong advantages of being part of the wider World Health Organization initiative. I suppose, Ceci, just one other query here then. So we have, I know in Ireland, we have the COSI data set, which is part of the World Health Organization Europe Childhood Obesity Surveillance Initiative. We also have the other, I suppose, key surveillance program in young children is Growing Up in Ireland, that data set. So, and I know there has been the health behaviour in school children report was out earlier this year, and there's been National Nutrition Survey data as well. How does COSI, I suppose, how do those data sets connect with COSI or reflect what we're finding in COSI?
So they're broadly consistent. Of course, GUI is a huge resource because it is a huge study of 2 cohorts, the older of which is now into their 20s. The health behaviour in school-going children is self-report, but again has the advantage of being a national data set. We've had a look at this and they're quite consistent, and I think Sylvia might want to chip in again here.
Yeah, so yeah, just to confirm what you were saying, Cecily, so comparing with, for example, with GOI, we have observed that there are slightly differences in terms of prevalence, while here in COSI we are seeing that the prevalence of overweight and obesity is around 20%. In GOI, it's around 25%, so it's different, but however, we can say as well that this difference can be explained by the fact that we are targeting different age groups. This is something that we need to take into consideration. Also, maybe the fact that we are taking measurements at different time points, or even that we are using slightly different, not maybe methodologies, but the people taking the measurements. This is something to take into account. But however, we can say, as Cecily was just saying as well, that our results are consistent with GOI, the GOI data, basically because in both studies we are seeing that the prevalence of overweight and obesity is going up as children or adolescents get older. So this is something that, of course, we need to take into consideration as well.
Thanks, Sylvia. And just one last question that's, I suppose, quite current and pertinent. And I don't know if we have an answer to it, but worth bringing it up. Will the current COVID-19 crisis have any impact on the prevalence of overweight and obesity among school-aged children? So maybe Sylvia, do you want to start on that one?
Yeah, I can. So at this point, I think it's a little bit early to say what the impact will be on the prevalence of overweight and obesity. Of course, we can expect that it will have an impact. Everything is just happening now, so there is a lot of research going on this topic specifically, and on many others. What researchers have seen so far, not in Ireland, but it's been published worldwide, is that focusing on school children, what they saw is that in terms of habits related to, or behaviors related to overweight and obesity, so what they have seen is that due to school closures and even the lockdown measures, so children decrease physical activity in general and increase screen time behaviors. And then in terms of diet as well, findings are a little bit inconsistent depending on the group or the population you are really looking at. So for example, in some groups they have seen that diet or dietary quality, sorry about that, it's improving because children were more at home, so then they were more exposed to home meals, which it's positive. However, again, if we maybe focus on those for more deprived areas, that they usually benefit from like school lunch programs available. So in that case, school closures negatively affected their diets. So I can say in the specific case of Ireland, a colleague of us, Dr. Celine Marin, she was conducting some research in this regard, and regarding the school meals program and how this current crisis affected that to the school children. And basically what they saw, like schools are really struggling with it. Of course, they try to still provide the children with foods using like local charities or partnerships or community settings, so that still they could get that. Now that schools have reopened again, the issue is that they had to cancel, or they are not maybe using all the facilities they have. For example, now at the moment they are not providing like breakfast clubs or after school clubs because they have to keep social distancing. So of course, as I said, this is having a negative impact on this specific population group again.
Okay. Thank you very much, Sylvia. It'll be very interesting to see as some of that research that's ongoing at the moment gets published, what the findings are, and then I suppose it is that longer term picture that we might get in terms of COSI down the line and that. Okay, so guys, just to say to everyone as well, after the webinar finishes, we will be circulating you with the link to the full report and the summary report online. So you will have that ready to delve into in more detail. I'd just like to thank our panelists, Sylvia, Lachlan and Cecily, and thank Dr. Donal O'Shea. I know you got cut off there, but you are back in. So thank you very much for your contributions. And similar to the minister and Stephanie and Lachlan, I'd really like to acknowledge the important contribution that the children, parents, and school communities in Ireland have made to this research over the years. Without them, this wouldn't be possible, and it's really important that we have the access to this type of data set to inform both what we're doing at policy and at practice level. So I'm just going to, before I wrap up, I suppose I'd like to say thank you to everyone here in the audience who took the time to join us today, for your interest and for those very interesting questions that came in. And finally, I'd like to acknowledge and thank a number of colleagues also without whom today would not have happened. In particular, just a quick shout out to Noreen, Paul, Earl, Leo and Seamus. Thank you very much for your help and your assistance. So as I said, we will be sending out the link to the full report and the summary document. They're on hse.ie, but the link will take you directly to where they are. So thank you very much. And as we sign off, I hope you have a lovely evening.
And thank you, Sarah.
Thank you.